What's up, everybody? Thanks again for joining me this week. My name is Kelly and I am a pharmacist. Now let me tell you what I was taught in pharmacy school. We were taught about drugs and how drugs are used as first-line therapies or second-line therapies and so on and so forth. We were also schooled in the long list of side effects that are associated with drugs and the whole benefit versus risk thing and all the things, right? Now with that being said, let's define what a drug is. The legal definition of a drug is any non-food chemical that alters the way a person thinks or feels or functions or behaves. And another way to define it would be any substance other than food that is used to prevent or diagnose or treat or relieve symptoms of a disease or abnormal condition. So with those definitions, doesn't it stand to reason that foods and the nutrients found in foods would also have potential to do the same thing? And that is where this is all leading to. I want us to seriously consider supplementation and nutrition as first-line therapy. So buckle up, class is in session. Today we're going to talk about the Restore product, Plexus's newest launch to their permanent line. So first of all, let's look at the product claims right from Plexus. Here we go. It says, getting back to your body's natural state of homeostasis can feel impossible when you don't know where to start. Restore empowers you with 3 carefully crafted proprietary blends, and it breaks it down into cellular defense, digestive support, and appetite control. It claims to restore balance to the body, maximizing results, elevating hope, health, and happiness. Okay, let's move on to the next part. What does Plexus say that this is indicated for? It divides it into functional support, saying that it helps your body function at its best, with support for gut health, good digestive function, liver function, and a healthy stress response. The next category, healthy protection, claiming it supports your body's natural defense against environmental toxins with powerful antioxidants that also assist with healthy aging. And the third claim, maximized efforts, supporting weight management goals with ingredients that aid in appetite control and help curb stress-related cravings. Okay, now we're moving into my pharmacy brain. What are some drugs that would meet these criteria when it comes to these health claims? Okay, let's address the first piece, the environmental toxins and the stressors. I think of things like benzodiazepines, right? Tranquilizers. So diazepam, clonazepam, alprazolam, Valium, Xanax, that's what I'm talking about. Or beta blockers, propranolol being the most prevalent used for this. SSRIs, the whole class, Zoloft, Prozac, Celexa, or the class of drugs called SNRIs, where it pulls norepinephrine into that picture. So we can look at Cymbalta or Effexor, going by the generics duloxetine or venlafaxine. The next claim, when it talks about good digestive function, I think of things that are pretty basic, right? Tums, Maalox, antacids for upset tummy. Or you can get into proton pump inhibitors. So again, Prilosec, pantoprazole, or Prevacid. The older class, which were these H2 blockers, and that would be like Tagamet or cimetidine. The motility agents, Propulsid, metoclopramide, or Reglan. Let's move on to the liver function piece, keeping our liver functioning properly or even treating an impaired liver. Actigol comes to mind, which is the generic drug ursodiol. Of course, they also use steroids for this. They may use lactulose for this to get things moving through the system and excrete waste. Or rifaximin, a drug also used to excrete waste from the liver. And the last piece, that healthy aging, the weight management, the appetite control. Well, we can go old school into the fen-phen, right? Now it's the phentermine paired with topiramate. Of course, the Ozempic and the Wegovy craze, or Orlistat or Contrave, which is just a combination of naltrexone and bupropion. So yeah, there are weight management products out there. And again, if you want the whole list of side effects, there's that. Which brings us to the label. What is in this stuff? Well, the first thing on the label is potassium. Then it breaks it down into these blends we talked about. Appetite control blend, hibiscus flower powder, yeast hydrolysate, magnolia bark extract, berberine hydrochloride. The digestive support piece is ginger root powder and peppermint leaf powder. And then the cellular defense blend would be spinach leaf concentrate, spirulina whole plant powder, and aloe vera inner leaf fillet powder. So now comes the fun part. Let's deep dive into these ingredients and look at the research that is out there on what these specific ingredients can do. So potassium, top of the list, let's start there. Potassium is known to help cleanse your liver. It lowers systolic blood pressure and cholesterol, which of course supports cardiovascular health. And that's just the tip of the iceberg. Let's move on to the appetite control blend. So it starts with this hibiscus flower powder. Now we know this plant is rich in antioxidants. And of course that protects against free radical damage. It has to do with keeping your cells healthy and functioning. It also lowers blood pressure. It helps improve blood fat levels. And interestingly enough, studies are also out there showing how it supports a healthy liver function. There are studies out there suggesting it's effective in weight loss. It's also high in polyphenols, and these are cancer protective. It also is protective against bacterial infections. In fact, one study showed it's effective in inhibiting the activity of E. coli. Next ingredient, yeast hydroxylate. Now this one is big on modulating the immune response by both lymphatic activity and by stimulating antibody production. It also has antioxidant properties, and this one even has the potential to modulate the gut microbiome. You heard me. It stimulates the growth of beneficial bacteria while reducing the colonization of pathogens. It also reduces body weight and accumulation of belly fat without having an effect on lean muscle mass. Moving on to that magnolia bark. There are more than 200 chemical compounds that are isolated from this. They happen to be anti-inflammatory, antimicrobial, antioxidant, neuroprotective, meaning protecting those brain cells. And that not only includes Alzheimer's protection, but even things like depression or anxiety. And the polyphenols in this magnolia bark have even been shown to improve sleep. And berberine, this is a biggie. Now, one of the main actions of berberine is to activate an enzyme in cells called AMP activated protein kinase. And this plays a key role in metabolism and energy levels. In fact, many studies have shown that this significantly improves blood sugars in type 2 diabetics. It does this by decreasing insulin resistance, increasing glycolysis, which just means breaking down those sugars in the cells, and slows the breakdown of carbohydrates in the gut. Berberine also increases the quantity of beneficial bacteria in the gut. It's effective as a weight loss supplement. It decreases total cholesterol, it decreases LDL, it increases HDL, and it decreases triglycerides. It reduces symptoms of depression. It has potent antioxidant properties, anti-inflammatory properties, and studies out there are even suggesting that it's effective in slowing cancer tumor growth. It reduces the growth of harmful microorganisms that would cause infections. It reduces fat buildup in a liver. And it's even been studied in heart failure patients, not only improving their symptoms, but reducing the risk of death. Okay, the second big category, the digestive support. First thing in there is that ginger root powder. Now, gingerol is the main active component in ginger root, and it happens to be responsible for lots of these medicinal purposes. So again, powerful antioxidant and anti-inflammatory properties, which plays into this reducing oxidative stress, and of course that plays into cell protection. It's used to treat morning sickness and other types of nausea. It helps with weight loss. It helps with osteoarthritis. It can lower blood sugar. It is well known for managing indigestion just by moving food through the gut more efficiently. It's effective in menstrual pain. In studies, it's been found to significantly reduce cholesterol levels, and there's evidence out there that ginger root even plays into reducing the risk of GI cancers, colorectal, pancreatic, and liver cancer. Next one, peppermint leaf powder. Again, this is tied to digestive symptoms like gas, bloating, indigestion, but it can also act as a muscle relaxant. And of course, that can work into being a pain reliever. And studies have found it's effective in both menstrual cramps and even headaches. Now we know peppermint is a common flavoring in toothpaste or gum, even mouthwash. And it might be because it has antibacterial and antiviral properties, as well as anti-inflammatory properties. It's been shown to alleviate nasal congestion and cold symptoms. It improves energy levels and decreases fatigue. In fact, one study, peppermint oil, was found to not only kill, but also prevent the growth of common foodborne pathogens like E. coli, Listeria, and Salmonella. Peppermint oil also kills several types of bacteria that lead to illnesses, including Staphylococcus and pneumonia-linked bacteria. Peppermint tea is also commonly used to relax you before bed because it's naturally caffeine-free. It also happens to be calorie-free, so people will use this because of the sweet flavor as part of their weight control program. All right, and the last blend is this Cellular Defense Blend. First ingredient, spinach leaf concentrate. And again, evidence is supporting that this spinach is effective in weight loss. And it does this by delaying fat absorption, which temporarily reduces appetite and cravings. Spinach is also high in insoluble fiber, and fiber, of course, is very beneficial in our health. Spinach also contains several important plant compounds. Lutein, which is linked to eye health. Camphorol, which is an antioxidant found to decrease risk of cancer and chronic disease. Nitrates, which promote heart health. Quercetin, which is both a potent anti-inflammatory and antioxidant. And zeaxanthin, which also is attributed to eye health. The next one, spirulina powder. Spirulina, first and foremost, is considered an excellent source of protein by the amino acid profile found within. Now, the main component of spirulina is called phycocyanin, and it is an antioxidant, so of course it fights oxidative stress. It increases the production of nitric oxide, which we know plays into muscle recovery. It reduces blood pressure levels. It's a very popular alternative treatment for allergic rhinitis. A recent study found it's effective in anemia during pregnancy and even iron deficiency in littles. It's beneficial in people with type 2 diabetes because it significantly reduces fasting blood sugar levels. And the last thing, aloe vera inner leaf fillet powder. So aloe vera has more than 75 compounds, including vitamins and minerals and amino acids. Now, this inner fillet of the aloe vera leaf is the highest concentration of these compounds. And it's well known for healing properties, right? But it also has antioxidant properties as well as anti-inflammatory properties. It's been shown to lower triglyceride levels, LDL levels, and it's been shown to increase HDL levels. It's used for treating constipation. It's used in treating acid reflux disease because it decreases that inflammation going on in the esophagus. It's also shown to be effective in IBS symptoms, specifically diarrhea and belly pain. And wouldn't you know, the studies are showing that it's doing this by reducing inflammation. Now, since we've wrapped up on all these ingredients and done our kind of shallow deep dive, did you notice that there is a reoccurring theme going through here? Heavy in antioxidant properties, heavy in anti-inflammatory properties, blood sugar stability, and gut health. And what do we talk about all the time? That these are the pillars of health. Plexus has got you covered. All right, moving on. Let's move on to dosing. So how do we dose this product? Well, it comes in a powder form. So it comes in a bag with a little scoop. Now, depending on what you are using this for, it can be used 1 to 2 scoops daily. And you're to mix this scoop of powder in about 12 to 16 ounces of water. Now, some people like it cold, some people like it warm. You can do either way. It's got a beautiful reddish pinkish color, and that comes from the hibiscus. It is sweetened with a non-GMO stevia leaf extract, and it is flavored from the real fruits, from the oils, the essences, the extracts, a lemon berry flavor. And again, there are no artificial colors or flavors or preservatives or sweeteners. And it is gluten-free. All right, you guys, thanks for hanging with me till the very end, where we have taken time to consider supplementation and nutrition as first-line therapy. And if you are new to this Plexus train, I am going to list my link in that description box so you can get on there and nose around, ask me some questions. Curiosity will get you on this train every time. And now you may know more than your pharmacist. Class dismissed.